shadow offices. The NSF closed at foreign offices in 2018, according to spokesman Robert Margeter. He said the agency planned on sending teams on short-term expeditions around the world to find ways to increase international collaborations. A USAID spokesman said the decision to shutter its Beijing office was due to significantly decreased access to Chinese government officials, as well as the agency's position that the Chinese model of development is not aligned with U.S. values and interests. The USDA confirmed that it moved a manager position out of Beijing. A spokesman said a department has retained an office in China that employs 8 people, 5 Americans and 3 Chinese. The office monitors animal disease and helps resolve trade-related issues as they occur at Chinese ports of entry, the spokesman said. Reuters first reported about changes to CDC staffing in China on Sunday. The news agency revealed that the Trump administration had eliminated the position of the U.S. trainer of Chinese field epidemiologists who were deployed to the epicenter of outbreaks to help track, investigate, and contain disease. In a press briefing on Sunday, Trump criticized the Reuters story as 100% wrong. Yet the CDC acknowledged the position had been cut. The agency said the decision was made because of China's excellent technical capability and said the elimination of that post did not hamper the U.S. effort to respond to the coronavirus outbreak. The CDC staffing document newly reviewed by Reuters showed a sharp decline in the overall number of employees at the agency of Beijing, with 33 out of 49 positions lost. The document shows a breakdown between American and Chinese staffers. The number of so-called American assignees declined to 3 positions from 8 at the outset of the administration. Positions lost included medical epidemiologists and other experts in infectious disease. The biggest cuts were to positions filled by Chinese employees on the U.S. payroll, down to around 10 from 4 over the same period. Many of those local hires included medical and disease experts, according to the people who spoke with Reuters. Local staffers stayed even longer at the CDC and had a real depth of knowledge. One of the people said there is a loss of deep expertise and institutional knowledge. The CDC told Reuters the 3 Americans currently on staff in China are a country director, an influenza expert, and the information technology expert, a temporary deputy director, arrived recently, and that job will be filled permanently, the agency said in a statement. In addition, 2 Chinese staffers continue to work on specific public health areas, including the training program, according to the statement. The shadowed USAT and NSF office in China also had a role in building scientific relationships and combating global disease, according to the 4 people familiar with the situation. USAT's Beijing office, which was staffed by a senior U.S. officer and 2 Chinese employees, was working on initiatives including multi-drug resistant tuberculosis and malaria, the people said. The office closed in 2019. The NSF office was once led by Nancy Sang, a respected American scientist who was a key link between the US and Chinese scientific communities. According to the US government official who spoke with Reuters, the office also employed 2 local staffers. She had far more contacts than most of us, said the official, who had been in China at the time and was familiar with Bihar law. She could have helped maintain vital channels of communication between the two countries, which to this day is greatly curtailed. Sang, who is now with the NSF in the United States, declined to comment about the closure of her office in 2018 and referred questions to the agency's public affairs office.